My name is Ashley Murray, and I am a pediatric emergency medicine physician at the Children's Hospital of Philadelphia. I've been there for 11 years, and I oversee the domestic violence work at our institution.
I'm Jessica Pilardi. I am a supervisor at Lutheran Settlement House in our bilingual domestic violence program for our staff IPV medical program. And I've been with Lutheran for 5 years.
Hi, thanks for having me. My name is Teresa Salinas. I am a medical advocate at Lutheran Settlement House's bilingual domestic violence program. And as part of the Stop IPV partnership with CHOP, I'm the intimate partner violence specialist at CHOP CareBots. The title of our project is Utilizing CBPR to Implement Sustainable IPV Screening Practices in the Pediatric Primary Care Setting. So the specific aim of the project was to collaborate with stakeholders at our clinical site to create a screening and referral workflow as part of clinic operations.
We've been screening and really educating our providers in the emergency department for almost 6 years. And in the last few years, recognized that our outpatient practices are also interested in implementing some of the same practice. And really felt that the CDRD grant was the perfect time, once we got this grant, the perfect time to implement and work with our community partners, because we knew that it would look different in the community practice versus in the emergency department. And we used the CDRD the project lasted over 2 years to implement our specific aims of the project.
So the community partnership with specifically CHOP CareBots and Lutheran Settlement House began in around 2014. It started with our leadership at Lutheran reaching out to social work leadership in the primary care realm right around when the CareBots practice was being set up. The social work leadership there was really interested in the work that we were doing at a few other sites that were in the city, and wanted to get our services there on site as well as CareBots was being set up. So at that point, we began our partnership. We have had full-time coverage of CareBots since 2014. So we're going on 7 years now, which is really exciting for us. So since then, we have basically been doing the typical ins and outs of a Stop IPV program, which is responding to referrals that are on site, doing outreach activities, and doing trainings with providers. And then we saw CDRD as a really critical as something that could be really helpful for our partnership to kind of elevate our next steps about making screening and referral solidified in the way that we had done at other sites. I think some of the benefits of a community academic partnership are that we both have so much to offer when we're, trying to tackle a certain issue like domestic violence, which is complex and difficult to, for one person to tackle. We all bring something different to the table, where the community partnership or the community partner knows, we've been working with patients and families experiencing IPV for many years. We know what their needs are. We know some of the challenges that they face. And then on the academic side, what we don't have at Lutheran is the know-how about how to apply these really rigorous research methods to improve something that we've already been doing. So we know we're pretty good at what we do, but there's a lot of room for improvement, which is what we were really interested in. And so partner with the folks on the academic side really helped us to get there.
And this types of research and partnership allows us to translate this work, have some research date-driven results, show outcomes, which eventually, downstream allows us to replicate in this work for the future. So next steps, our partnership continues past CDRD. We are working on publishing our results. We have our MPH student who's now graduated, who's leading the publication, is really passionate, was really crucial to us to getting this project organized. We, additional funding, Jessica, myself, and one other partner from Temple have received a Robert Wood Johnson 3-year interdisciplinary research leaders grant, really stemming from this work. The project's a little bit different. It's a qualitative project looking at how we can elevate our survivors' voices in the healthcare field. And so it was just another opportunity that we could expand upon community-based research in a different way. We continue to work together on numerous projects, more and more projects, each week. We've published several op-eds and continue to write together. We'll be creating a podcast shortly. And it just allows us to grow as a partner.